surfactant. So pulmonary surfactant. So what is the function? So the pulmonary surfactant, it lowers what? It lowers the surface tension and the surface tension of the water layer. The surface tension of the water layer. And where is it present? It is present at the alveolar surface. So it is present at the alveolar surface. And what does it do? It increases the lung compliance. It increases the lung compliance. So thereby what happens is it makes it easier for the lungs to expand. So the lungs can expand. So the expansion takes place easily. And it is secreted by, we need to know that it is secreted by the type 2. It is secreted by type 2. This is very important. Type 2 alveolar cells. Secreted by the type 2 alveolar cells. And another thing is that it is a mixture. It is a mix. It is a mixture of the phospholipids and the proteins. So it is a mixture of the phospholipids along with the protein. So there are 4 unique apoproteins. So we need to know there are 4 unique. So there are 4 unique apoproteins of surfactant. So what is it? The surfactant proteins, they are SPA, B, C and D. So the SPA, B, C and D. So now we'll break down each of them. So we're going to look at the SPA. So what is meant by the SPA? So the SPA is nothing but it is regulation of the feedback uptake. So it is a regulation. So it is regulation of the feedback uptake. Regulation of the feedback uptake. And what is it of? Feedback uptake of the surfactant. And this is by the type 2. It is by the type 2. Type 2 alveolar epithelial cells. So it's by the type 2 epithelial cells that secrete it. Next, we'll be looking at the SPB as well as the SPC. So SPB and SPC, they are nothing but a key protein members of the. They are key protein members of the mononuclear film. So we have discussed it is a key protein member of the monomolecular film of the surfactant. Then we'll move on to the SPD. What is the SPD? So under the SPD, it is nothing but an organization of the SPB. It is an organization, and this is of the SPB and the SPC. So it is the organization of them into the surfactant layer. So another thing to notice, in case a deep breath is taken, so in case of a deep breath, what is noticed is that it increases the secretion. So the secretion is increased in case of a deep breath, and secretion is by stretching the type 2 cells. So there is a stretch in the type 2 cells. And its a concentration, it decreases when the breaths are small. So its concentration decreases when breaths. So when the breaths are small, the concentration decreases. So this was done. So now we'll be looking at another condition. So in case we are looking at fetus. So in terms of the fetus, the surfactant, if you see, it is the synthesis, surfactant synthesis. So the synthesis is variable. And the surfactant, it may be present as early as the gestational week 24. So it can be present as early as 24 and is almost present by the gestational week 35. So it can present as early as 24 and can be present by the gestational week 35. So this was completely about the pulmonary surfactant. To learn and grow daily, please do subscribe.